Fab. So, hi Annie, how are you?
Hi, yeah, really good, thank you. How are you?
Yeah, not too bad, thank you. I'm happy that it's sunny again now. How's your day been?
Yeah, not too bad. I just got home from being stuck in traffic. Working at the hospital right now, so just around the hospital site. It's always so busy.
Yeah.
That always takes a while. Yeah, no, had a lovely day. How was your day?
Yeah, it was good, thank you. Not too bad. Which hospital are you based at?
I'm working at St James's Hospital now in Leeds.
Okay.
So I'm doing Clinical Pharmaceutical Sciences at Leeds. We're actually spread over like 4 locations
Wow.
for 4 rotations. So we're a little bit all over the place. I don't know what it's like for you guys. No, but yeah, so just here for a little bit and then moving on in a month.
Okay. That's crazy.
Yeah.
You have to like move sites all the time. Are they all quite close together or?
No. So there's the 2 hospitals in Leeds, which convenient enough, there's like a free hopper between the 2, so that's too bad. But then there's another location just outside of Leeds. But then the other place where we go is Huddersfield, which is maybe like 45-minute drive from Leeds. So that's a bit of a trek, but yeah, no, it's really good.
Good. It's annoying that you have to kind of go all over the place. Will that be the same in second and third year, or do you kind of? Okay, well.
Yeah, no, it stays the same. I think we rotate our first and second year, and then our third year we don't specialize, which I just realized that other specialisms do. But I think we do our elective and we work on a research project. And then we've got the option to go back to any rotations to if we want to.
That's really good.
Yeah.
Because it kind of keeps it all open.
Yeah.
Cool. So you're going to find out. I did try to actually do some reading on this one, which I don't always do beforehand, but you're going to quickly find out that I know nothing about CPS.
To be fair, nobody knows anything about it. Like, unless you are actually actively doing it, like nobody knows.
So what is it? It kind of sounds like to do with drugs, but I don't know if that's right.
Yeah, it's got to do with drugs. So Clinical Pharmaceutical Sciences, basically we work in a prep services of the NHS for medicines. So all the drugs that the NHS buys in to give to patients, we kind of oversee the whole aspect. So we oversee everything from choosing your supplier. So you need to assess that the place where that drug is being produced is up to standards or whatever. And then some drugs they need, for example, over labeling, or maybe you've got like a blister pack of 20 and you want packs of 10, right? So they need to be packed down or whatever. And then a lot of medicines actually come in powder form, so they need to be reconstituted. So just addition of whatever water injection or NaCl, whatever. And it is just a lot better to do it in a clean environment. So that's where we come in. We just make sure that those drugs that are going directly to the patient are being prepared in safe settings. And that's kind of like a really quick overview. We do a lot more than that, but yeah. So basically we work in clean rooms mostly. Just
okay.
Not very.
I've never thought about that, I never thought about like the medicines that you get as a patient having to go through all of those steps beforehand. You just kind of think they're always there.
Yeah, me too. It was a big shock when we first started, actually, because the first thing we saw, I think, was just like over labeling of tablets or whatever, which is, I mean, you always think, right, fine, somebody makes them, puts them in a pack, and then sells them, right? But there's so many steps. There's so many checks. There's like 3 different people at 3 different stages. Only at the end, like after the product has been made, just before it goes to the patient to check that what they're receiving is the correct thing, that there's been mistakes, there's no misspellings, that is clear, can be read, it's got the correct braille letters, and there's just so much that goes on that you don't think about it.
No. All the little things that happen in the background, you're just like, yeah, they're just normal things that happen, but you forget that someone has to do them.
Yeah, exactly. But we don't really have patient contact. But yeah, I mean, if nobody was doing this job or carrying out these checks, making sure we actually do contribute to patient safety a lot. The cool thing is actually the rotation I'm in right now is Radiopharmacy.
Oh.
I know, right? So we basically work with all sorts of radioactive, selected radioactive substances that are basically bound to chemicals that just have the task to carry that radioactive component to a target organ in your body so that you can go and get scans done, or for cancer therapies as well. So what we work with most is just cancer, chemotherapy, all sorts of thyroid. It's a bit sad, but it's really fascinating because everything in your environment is potentially radioactive.
Yeah. Do you have to wear the big like suits? I'm imagining like in Monsters Inc. when they have to come and decontaminate the stuff.
Yeah.
Okay. No. I watched Monsters Inc. the other day.
So not quite, but you wear the really big suits with the hoods and everything when you go into the clean rooms.
Okay.
So that's where all the action happens, really. Outside of them, not really. I think just for COVID, we're wearing scrubs now. Otherwise, we wouldn't. But yeah, you have to go around with like giant monitors and things, like checking that all the places you've been are not contaminated. And we wear like body badges to control the levels of radioactivity you've been exposed to over a month to make sure that you're not exceeding it.
That's crazy. Yeah. So that's where you are at the moment. What other rotations have you done so far?
So we've only got 4. We have QA/QC, quality assurance, quality control, which is the center of it all, really, because it always does encompass everything. So it's basically just make sure that the premises you work within, the facilities you're in, and the equipment you're using, and the people that are doing the work, and the materials are up to standards. And there's a whole lot of work that goes into that. Because for example, we do microbiological testing on all the workplaces, like work surfaces. You have to control the temperature in the warehouse, in the offices, but also obviously in the clean rooms. It's a whole thing. It's really interesting. And then we deal, for example, with special orders, like medicines for compassionate use, for example, if they need to be approved or like unlicensed.
What would that kind of be? Is that like end of life care?
Well, not necessarily. I mean, yeah, but it's more like if there's a particular medicine that's not licensed in the UK, but it's licensed somewhere else, and some patients can access them through compassionate use. And I think in some instances they don't even have to pay for them. So if they're private patients, they wouldn't actually have to pay for them on the compassionate use. But I'm not 100% certain. Definitely some of them. But yeah, so you can, in special circumstances, you can access medicines that otherwise you wouldn't be able to.
That's really good.
Yeah. Okay, so we've got Radiopharmacy, QAQC. We work in Aseptics, which is also really fundamental and applies to everything. It's the clean room aspects of everything. So mainly things like chemotherapy and like parenteral nutrition, antibiotics. It's usually all the IV drugs. So they just have to be made sterile environment under very strict conditions. You have to wear like, well, you change into a pair of scrubs and then you wear a boiler suit and boots and a hood and goggles and a face mask and sterile gloves. Yeah.
I'd be sweating and all of that.
It gets really hot. It's awful. Yeah, so that's really quite cool.
Yeah.
And then the last one is production. And production is basically all the other types of medicines, like tablets and capsules and creams and ointments, which is actually really quite interesting. That's my favorite actually. Yeah, because basically you go into a dedicated facility and they've got like giant mixers and they've got a whole lot of chemicals and things in it, and start spinning and mixing, and what comes out is so nice. It smells really nice, and then really quite satisfying to watch. And then you just you're just sitting there putting it in jars and weighing it and having a chat with your colleagues, you know. It's really quite nice. It's obviously like under controlled conditions, in a controlled environment and everything, but it is really quite nice.
Like making something, you've got something at the end that's just yours.
I mean, I think as STPs, they don't really let us make a whole lot, or you have to be. I'm only first year, so I'm not really that. But as a general rule, they wouldn't have you make a whole lot. Which is fine.
It's against the other. I know you said that there's not much patient interaction. One of the things I was going to ask was what kind of patient referrals you'd see, but I guess you're seeing some like everything if you're doing like medicines and things like that.
No, you would think that, but so radiopharmacy is within the nuclear medicine department, so we mainly get like cancer patients. So those are the only patients really that we would have contact with. Otherwise, the other thing that can be done, but it's not frequently done, is you could go on ward rounds, maybe to see the administration of antibiotics or chemo or something. But again, it's not routine. It's something that like you have to arrange, which wouldn't be a problem, but it's a little bit like extra curricular. Yeah, but it is really quite nice.
Do you have other trainees in CPS, or do you kind of work with other trainees in like nuclear medicine?
So I think at Leeds it's 2 trainees in my year. We had 2 trainees third year, so they're graduating this year, and I think they're hiring 2 more this year, so this coming year. I don't know if they're gonna hire every year. And also because of capacity, like the radiopharmacy department is super small, and also because of COVID, and you have to have like limited numbers of people in each like room or whatever. They can't really have both trainees in the same place at once, so we tend to rotate separately, so you're always kind of by yourself. Yeah, but then it's really flexible, and my colleague and I, Abigail and I, we meet up for lunch every now and then if we're in the hospital, you know, and then we chat. So it's really quite sociable. And I've only met the physics STPs once. just because they were training in radiopharmacy, but otherwise I've never really met any other STPs.
How many trainees are there like in our year in CPS?
I think my year was like 10 in England.
Okay.
Yeah.
Not loads.
No.
Well done
A
then.
whole lot. Yeah, well. Yeah, no, but it's really interesting.
What was your background beforehand? Because like I'd never heard of it before. Is there an undergrad in that? Do you do an undergrad in something else?
I did pharmacology.
Okay.
I did the one with the integrated masters.
Mhm.
And I studied in Scotland as well. So my degree was like 5 years.
Yeah.
And then I had experience in industry. Yeah, I don't know. Like that's kind of my experience. I know that my colleague has a degree in chemistry,
Okay.
and I think the people before me, I think actually one of them has a PhD in chemistry as well. So, and I literally graduated last summer. So you get going like,
yeah.
You know,
So you didn't have like experience in like a hospital beforehand?
very little. Like I worked in a diagnostic lab back in Italy. I'm Italian, so I worked in a lab, and that was patient facing and with patient samples, but it was nothing to do with medicines or anything. And I did a bit of volunteering in a hospital. What else did I? I forgot.
That's all right. I forget like my history all the time.
Yeah. But yeah, not entirely relevant. But then I suppose because I had a highly relevant degree.
Yeah.
Also, I think what you write and how you write in your application had a big impact. And they want to see. I think the impression I got was that they wanted to see people who are eager to learn and have patients patient best intention, best
Interest.
yeah, patients' best interests in mind all the time.
Yeah.
So constantly always put patients first. So I think that's mostly it, really.
Yeah. That's good though. Like even if it wasn't exactly relevant to what you'd done before, a bit of work in like a diagnostic lab is never gonna hurt.
Yeah, no, exactly, yeah. Yeah, I got lucky.
No, you didn't. I bet you did very well. So what I know the uni stuff is all broken up into different bits. And like I did some uni with like repro and genetic counselling. What uni stuff do you do alongside pharmaceutical science, or is that just it?
Yeah, we do the same like the subjects or like broad topics that we do our rotations in. So we get radiopharmacy, but obviously then radiopharmacy is like the chemistry aspect of it and the legislation aspect. That's the whole thing as well. I think it's people's least favorite topic because you have to learn the legislation and the regulations and everything that underpins everything that we do, which is super important, but takes a while. So you have to learn like how to set up a radiopharmacy unit and how to run it and how do clean rooms work. Like there's a whole system of filters and fans and all sorts. For production, we did formulation sciences, which is actually super, super interesting. That's it. And then we get like a little bit of microbiology in. The most interesting bit was actually learning about all the incidents that happened like in hospitals over time that were just caused by essentially not following the regulations properly, which is just there to show us like that if you're worried about something, if you've got a question, ask the question. If you ask why, always ask the question, and try to be as, I don't know, detail oriented as you can. But it was super interesting.
That's good. Which uni are you based at?
We're Manchester.
Okay, so not too far away.
Not too far away, but we didn't get to go yet. So I've not met any of my course mates.
Was it all in one block? Like we did all of ours in October, and then.
Oh, is that what you did?
Yeah, we just had all of October as teaching.
Oh, really?
Yeah. Was that not? I'm guessing that was not what you did.
We had like a week off every now and then.
Okay.
Well, not off, a week of teaching every now and then. I think it was like every 2 months or something like that. But yeah, no, it wasn't a whole block. That would have been cool. So what uni are you based at?
We're based at Manchester as well.
Oh, are you?
Yeah, in the, I'm going to get this wrong. I think it's the life sciences bit. It's called like Maze or Mars or something.
Oh, yeah. M-A-H-S-E. Yeah.
That's the one. But yeah, we just had it all in October, and it was good to kind of just bunch it all together, but also I fell behind very quickly and carried on being behind for the whole of the rest of it.
Yeah, I can imagine that. Like, did they just give you all the assignments in one go in October?
We only had, so we had one assignment for bioinformatics, which was due like at the end of the week of teaching, but it was a group thing, so it wasn't too bad. And then we had another one that was like an individual assignment due a month after. But then we only had one essay due in April, and the rest were exams. So. What were yours like?
They replaced all of our exams because of COVID, so they were just assignments. We just, I mean, worked out quite well, to be fair. What did we do? I think we just had like a whole block of teaching for about a week, and then we would all go back to our jobs. And in that week, they would give us sometimes assignments for like the same week, not often though, or they would just explain the assignments for the end of the semester or the end of the year or whatever it was. But then the really good thing was that we had the same lecturers throughout, almost the same lecturers, so we could always ask questions about a different course. I mean, nobody ever did, because like if you're, I don't know, studying radiopharmacy, you're not really asking about something that's completely irrelevant. But if you had a question about an assignment, then they're always there, and they were actually so nice. They would always stay behind at the end of the day as well, in case you wanted to go and chat or ask questions. So yeah, it was quite nice.
Have you liked it? Did you like the uni side and everything?
Yeah, I did. It was lovely, but it wasn't the same thing as being in actual uni. Yeah, and also following lectures online is so hard. It's really hard.
Especially if like your desk is in your bedroom. I'm just there like, there's my bed. I'll do it in bed, and then
and
then
I get that. There's so many snacks around the house.
And just distractions everywhere.
Yeah.
Do you know what kind of thing you'll be able to do a research project in, or do options get given to you like in second year?
I think they were already talking about options. I think we've got a really fancy robot in one of our clean rooms for like, I don't entirely know. I think for some dispensing, but I don't entirely know what it does. I've not been very involved yet. And I think that's going to be part of one of the projects. I don't really know what else is going to come up. But we were told to kind of start keeping an eye out in case that we like pops up, or in case maybe we get an idea and want to discuss it with a supervisor and see if anything can be arranged. they are quite flexible in that respect.
That's good.
Yeah.
Like you might get kind of a topic, but then be able to push it towards what you're interested in.
I think so. Or like, yeah, broadly speaking, I'm sure they would give you some wiggle room. They're usually good with that. What about you? Have you chosen yours yet?
So I think how it works for us is we get a list of kind of projects that are needed by the department for people to kind of look into, and we can kind of pick one of those, and then similarly, if you want to kind of push it slightly into an aspect, you can go down that route a little bit.
I think it's kind of the same. Yeah.
But I had written down like a few questions.
I thought
just so I didn't have, because this is my first one that I've done in like months.
Oh,
so I
really?
didn't want to have like a mind blank.
Oh, bless you.
But is there anything else that like you wanted to mention about it, or like tips or anything? I definitely know a lot more about it than I did, and if I ever get medicines again in a hospital, I'll think of you.
Honestly, I think I really like it. I really, really like it. I think it's super interesting, and the learning curve at the beginning is so steep. It's really scary at the beginning as well, because you're faced with this huge amount of things that you're supposed to learn and know, and people are talking, and all the acronyms and the things they're talking about make absolutely no sense. But then you learn really, really quickly, and people around you are always so nice. I'm sure you get this as well, like, because it's the nature of the NHS as well. Everybody's so nice, lovely, and friendly, and everybody wants to help. So I think that is a massive help, actually. Tips. I think what helped me most was talking to older STPs from third year, and they were able to sit down with me and give me a whole lot of tips, what they wished they'd done differently, or what worked best for them. So I think I would say always talk to the previous STPs or similar STPs in different locations, specialisms. I think that always helps. And then just be organized with things. That's yeah. Cause how do you keep on top of all? Like, it's too much otherwise.
I'm always amazed by people that are just like, I'll just wing it. I'm like, no, I could not.
No, I can't do that. Like, you need to have everything planned out, a giant to-do list, calendar, and like a notebook for everything, a folder for everything. The whole thing.
Got everything out beforehand.
I think we're all kind of like similarly minded, all the SCPs.
I think you have to have an element of organization to get on. But yeah, I think other people just seem to be less stressed, which is always good. But I'm like, nah. Brill, well, thank you so much for doing this and racing home from work.
No, it's okay. It was well worth it. It is actually, though, because as I was saying, nobody ever knows what we do or who we are, or exactly. It's really hard, and it's really hard to explain as well.
I know. Like, my friends ask what the STP is. And I try to explain it, but I find it really hard to explain as well. So I'm like, how are they going to understand?
What is the STP? It's like, I was trying to explain it to a colleague at work today, and it was just really hard. No. Oh well.
But yeah, thank you so much.
Oh, pleasure. Thank you too.
See you soon.